got Ken in here. Ken is currently an athletic director. He was in here a number of years ago, coming from a long distance away, so we haven't got to see him too much. You guys will see today a full body treatment. We're going to work a little bit on his feet, his neck, his shoulders, his wrists, his elbows. We're going to do some soft tissue treatment throughout the body, as well as some exercises to help balance his posture out that he can take home with him and work on for the next couple months until we see him again. Ken, what is your athletic career?
Well, I was a wrestler through high school and college, and then I was a Division I wrestling coach for 16 years. So put my body through lots of work and lots of physical and some trauma.
We talked a little bit about multiple surgeries. Why don't you just tell us a little bit about what's been done in your body?
A meniscus surgery in my right knee, and ACL surgery on my right knee also, and then after the surgery I had some MRSA in my right knee, so that was a big part of some right knee difficulty, and then I've had bunionectomies on both my right and left feet, kind of the great toe areas, and then surgery on the left elbow that was dislocated several times, and some surgery on my right hand and right thumb.
All right. So, right hand, right thumb, left elbow, right knee primarily, double feet. Yeah, so this guy's been through the ringer with the orthopedic treatments, medical treatments, and we feel the stress, tension, and spinal and extremity misalignments, which you guys will see on video, how we're going to do some soft tissue treatment, as well as adjustments throughout the body. So Ken, right off the get-go, has big time arthritic nodule, bony nodule up in his neck. Look down for me. And do you feel the soreness around this right side right here?
Yes.
Yes. So he's got a big bump right here. Look up, look down, look up, look down, look up. And what we want to feel in the cervical spine is like a nice smooth kind of almost train track distribution of the vertebrae. We don't want to feel any big nodules, kinks. I'll say kink a lot, which basically means a vertebrae sprain, a joint sprain in the neck. But we definitely have some arthritis, as we can feel with our fingers as we palpate through the spinal column. Look down for me, buddy. And as you guys have heard on numerous videos, how important we feel stretching is, right? Stretching and daily postural habits. So you saw maybe Bree will put in the video pre and post square up stance pictures, where we talked to Ken about how important it is to square the stance up in our go to foot position. One of the things I missed out on in practice for a number of years was the importance of having a straight and balanced stance, as well as working the internal rotation of the feet and then the external rotation of the knees and the legs into what we call our double bow set stance. You guys will see a picture of that on the video of what Ken looked like before we powered up his stance versus after we powered up his stance. Look down for me. Look down. Look up. 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 Look down. Perfect, buddy. All right. And Ken has not been worked on for how long? Long time here?
Long time, yeah.
Any chiropractic appointments up at Clarion?
Yeah, probably 7 weeks ago is my latest.
Last adjustment?
Yes.
And maybe after you can tell us if our treatments are similar or different. One of our areas that we focus on a lot in the office here is myofascial release and muscle work paired with our adjustments. I feel that as a chiropractor, it's important to address both the soft tissue components as well as the spinal components and extremity components with adjustments, and fascial release or muscle, any kind of muscle release to help elongate and create some neurological change in the soft tissue structures prior to the adjustments. Look up, look down, 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 look up, look down. Does your other chiropractor do any muscle work?
No, not currently.
Look down, look up, look down. Good. Okay, man. All right, then we check the Glenohumeral movement. Left side's pretty good, right side's a little stiffer. Let's scooch forward for me. Hands back and down. Let's go fingers in like this, turn them in. Can you get them behind you? Perfect. All right, so you guys can see how when we start to put him in this position, how he rounds forward a little bit, both scapulas start to wing off the back. Now, Ken, we're gonna talk about, just like we did with your stance, how to power up your upper back. What you're first gonna do, just try to pull your shoulders back a little bit. Perfect. You guys can see how he engaged his posture. He started to sit up a little taller. Can you try to straighten and first, you guys will see, and he did have left elbow dislocation and surgery. There's a bunch of arthritis around the olecranon down here. You guys can see probably in the video how his right elbow is a little straighter than his left elbow. Ken, we're gonna say squeeze the shoulders back a little stronger. Can you straighten your right elbow up a little taller? Perfect. Can you try to straighten your left elbow up a little taller? Is that tightness? Is that pain? Is that...
That's just about as far as I can make it go.
Do you feel, is your left wrist tighter than your right wrist, or right wrist tighter?
Left wrist is tighter, and there's some, I can feel the popping in my left elbow.
You feel some?
Yep, yeah.
Okay, now you guys can catch out right here on video how we're starting to see some tricep muscle fasciculation. That's muscle activation. Can you feel your tricep on this left side?
Not really all that well.
You feel the tricep on the right side,
yeah.
okay? So if we guys look and breathe and kind of come up, he's got some injury precursors. The left elbow is obviously his more difficult elbow due to surgery, dislocation, as well as some arthritic growth down in the elbow. Squeeze this right tricep. You guys can see how he can fire this tricep a little bit. Now, Ken, we're gonna pull the right shoulder back a little bit, and then we're gonna just try to lock this right arm up nice and tall. Good. And then let's come back to focus on the left side, Bree. Focus on left elbow straight. And you guys can see as soon as we tell him to activate the tricep by straightening the elbow, how we get that little muscle fasciculation. This is where he's got some neurological muscle weakness. This is a very low grade, unweighted exercise that will help Ken here to develop stronger back muscles. We're gonna pull the shoulders open a little bit. We're gonna try to pump up the left elbow a little more. Let's hone in right there. You guys can see how we position his posture better and how we get that awesome tricep muscle activation right here. This has been a dead muscle, an atrophied muscle for a long period of time because Ken has not been doing this as a tricep exercise, but he can start to feel how there's a little bit of twitching right here. And right now his brain is working super hard to try to straighten the left elbow a little more, and we crank up the intensity, the neuromuscular activation of the tricep. So Ken, at home, I need you for a cumulative effort, 20 minutes a day, to try to sit in this position. You're gonna do two things. You're gonna pull your shoulders back, that's step one. You're gonna focus on right elbow up straight, and then you're gonna focus on left elbow up straight to the best of your ability. And if that is doable, we're gonna start strengthening the triceps significantly. This is gonna help him long-term to reduce further arthritic growth in the elbow, as well as promote a fuller extended elbow, more joint range of motion as we get this tricep stronger. Take a break from me, Ken. All right, let's move the hands up here to the side. And then we're gonna do same thing. Just try to first think shoulders back, okay? Do you feel on the right side how this lat feels right here? How it's a little tense. Can you squeeze here a little bit?
Yeah.
Good. Can you squeeze the left side? And you'll feel how the left side's a little more dead compared to the right side. Like squeeze here, that's good. Squeeze here on the left. See how it's a little weaker?
Yeah.
Okay. Now, your back chain musculature is inactive on the left, or it's less functioning than the right? This side's a little easier to neurologically activate than this side. And what we need to do here, Ken, is just as we watch TV throughout the night, or maybe we're sitting on the back deck, watching the sunset or something like that, I want you to start to incorporate this as one of your back exercises. You're going to do two things. Let's first try to flatten the hands down gently. You're going to softly pull the shoulders open. We're going to softly straighten up the right elbow gently. You're going to softly straighten up the left elbow gently. And again, as he starts to focus on this left elbow straightening up a little more, we're starting to kind of jump start the tricep. And you can see how he's got that fasciculation again, which is just our way of knowing that he is firing and feeling how much tighter in the left arm than the right arm, right? Now, step two, after we just sit here for a little bit, it's going to be to add a little coil in. And a coil is where we're going to twist to the right shoulder blade. Look straight forward for me. See how this side feels? And then let's go left shoulder blade back. And you feel how much more difficult on this left side. Yeah. And then right shoulder blade back. Look straight forward for me. And then left shoulder blade back. So if we say cut left or cut right, this is how we start to cut. You'll feel as you do this how the arm stretches, how the back muscles activate, the tricep activates. You'll start to feel, let's pull the right shoulder blade back. Kind of focus, see how strong this lat is here, how tense it is. Now give me the left side back. And feel how this, there you go, that's pretty good. Do you feel how much tighter on this left arm though?
Yeah, my left arm's
numb a little bit right
yeah,
now?
the forearm, yeah.
So as we do this, we're stretching the wrist, we're activating the back chain tricep, we're activating the lat. Give me a nice double shoulder pull back, give me a nice right elbow straight, and give me a nice gentle left elbow straight. Which if that's all you can do, that's fine. Good, take a break for me. Just kind of shake it out a little bit, move the arms, the shoulder blades around, pump left, and pump right a little bit. And pump left, and pump right. Okay. All right, good work. So that's exercise one that we want Ken to do while he leaves here. And he's gonna try throughout the day cumulatively to rack up 20 minutes in that position. So whether he does 2 minutes in the morning, 2 minutes before lunch, 2 minutes after lunch, 2 minutes in between emails here and there, and then maybe 5 or 10 minutes at the end of the day. That's going to help us to improve the tricep activation on the left side. It'll gradually improve his range of motion of his left elbow. It'll start to create better joint motion down in the elbow, better wrist, finger, and shoulder flexibility. And it's going to help him from developing further arthritic growth down in that left elbow, because movement is life. We got to move the right way. We got to activate our back chain muscles. We have to free up scapular adhesions and shoulder adhesions, tightness up in the neck, tightness up in the shoulder. Look down for me, buddy. You guys could see on camera how beautiful that left tricep started to turn back on. Many people, they lose connection to certain muscles because they don't put their bodies in these positions enough, and then tension throughout the body starts to really take over, and we get wrist tightness, elbow tightness, neck and shoulder tightness. Look down for me. Look up, look down, look up, look down, look up, look down, look up, look down. All right, good work, my man. All right, let's lay face up on the table. Now, guys, we are going to point out some issues with the feet, but first we're going to work up into the elbows and the forearms, just finish up with some treatment in the upper body, palm up like this, all right? So muscle adhesion and fibrous adhesions develop, and you can see this kind of big ball that we've got in Ken's elbow right now. And so one of the things we want to do is improve circulation to that restricted joint. And you just tell me if this gets a little too tender in some spots. You can kind of feel right through here is a little tighter. Mm-hmm. Guys, what we're doing is treating the front line, the front arm line of muscles and soft tissue structures down through the bicep, the medial epicondyle, and right into the forearm here. We're going to try real easy to do a mobilization of his right elbow, or left elbow, and right elbow. Now let's go up here a little higher. And common reactions to have to soft tissue treatment like this: the area can be a little sore after, it can bruise a little bit, because we are breaking up a lot of fibrous, a lot of tight tissue around the bone structures.
I can feel that close to my elbow.
Like right in there.
Yeah.
How sore that is right there.
Yeah.
So this is where people get golfer's elbow, which is medial epicondylitis, and very common condition to have when we underuse the back chain muscles. The back chain muscles are our triceps and our lats, or posterior delts, and all those shoulder muscles that we just activated a little bit. Good. Take a break. And very common to develop a lot of adhesion, a lot of muscle adhesion around the bicep. The short head of the bicep, which is the medial bicep. And you can feel that little sore spot right there.
Yeah, right there, yeah.
So these guys, these muscles, man, they just like start to grow together, right? They're like roots on a tree, and they just crisscross paths, okay? And then the muscles, they start to get real tight together. Good. Rest that hand right there. The muscles start to get really tight together. They start to adhere or almost get glued together.
In June, I popped a long bicep tendon in this.
Did you really?
You'll be able to see that.
How'd you do that?
I was trying to lift an old television in the back of my car, and
Just felt a pop.
Yeah.
Not a full tear though?
I think it's pretty much a full tear, but I went to the
ortho,
and they said I don't have any difficulty with range of motion or pain or anything else, and they're not going to mess with that.
So the bicep didn't kind of ball up.
No, you can see a little bit of just a bit,
yeah.
Dysfunction, disfigurement there, but
Pull this up right now, right there. Oh yeah, right there.
Yeah.
So this treatment can, and we'll do a little muscle work here as well, but you guys can see how the bicep is kind of like balled up right here. And oh man, you feel those little bumps right there? So he's got a bunch of fibrous tissue that's grown. And we're gonna go easy on the bicep. But it is important to start working this area out to prevent the muscle from developing a contracture, which is just a really tight ball, really tightened up ball of muscle that ultimately will cause elbow dysfunction, shoulder dysfunction, ongoing pain in different areas throughout the arm, spinal misalignments up into the CT junction, the cervical spine, and the upper thoracic spine. You guys can see the difference in this left elbow or this right elbow, how it's not as swollen, arthritic as what the left elbow is, right? The right elbow is a little healthier, much healthier than the left side. But he also has less trauma on this right elbow. He dislocated the left side, and that was a precursor to, arthritic growth, bone growth down in the elbow joint. All right, good work. Hold right there for me. I'm gonna do a little bit of and what you want to find up towards home, either with the chiropractor or the massage therapist, somebody's got to get their hands up here and start to reduce some of that, feel that spot right in there.
Yeah.
So we actually want to start to break this up a little bit before it tightens up, and there's the big spot right there. Let's bend your elbow for me and then straighten it. And then bend it and straighten it. And bend it and straighten it. Yeah, you got beat up here this life, huh? Pain, no gain, right?
Yes.
Some of it. Down. And bend. And down. And bend. and extend. Good. And bend and extend. All right, good work. Let's see this hand and wrist. And thumb, is it okay? Good. Relax your arm for me. Good. And then let's see this elbow. All right. Bend into my hand. So bend, no. Like, yep, there you go. And now just a little easier. And then relax for me. Bend gently right there. Is that okay?
Mm-hmm.
Good. Relax for me. Let me straighten full way. And what we're doing here, guys, is just working on getting full extension back into the elbow. Bend, 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 bend. And stop. Roll this right shoulder open. Bend your elbow again. And stop. Does that pull or is that okay?
It's okay.
Bend. And stop. Bend one more time. And stop. All right, good work. Okay. So what you want to work on at home, Ken, when you lay in bed, palms open like this, you want to put your brain into your thumb tips. So like down here, so think about these two areas. Just try to twist both hands out. And as you twist, let's say the left hand out, thumb back like this, try to roll the shoulder open. And then hold right there. And let's think about the right side. Roll the right hand out. And then secondarily, pull the right shoulder back and open. Okay? So I want you to start laying in bed. You're going to straighten your left elbow fully. You're going to try to open your left hand up. You're going to straighten your right hand fully. Spread your fingers wide. Turn the right hand open and try to straighten that right elbow fully. Feel how that just kind of untwists. It opens up. See how that feels? Left hand open, left shoulder open. And about 10 seconds of focus. And then right hand open, pull that right shoulder blade open. So something easy to work on in bed at night is just kind of laying here in a nice open position. Focus on left elbow straightening out. Left thumb opening out. And then right elbow straightening out. And right thumb opening out. You want to kind of get as long as you can, as open as you can to the elbow. So in your brain, your checklist is thumb out, elbow straight, shoulder rolls and pulls back. And then right thumb out, right elbow straight, and then right shoulder blade pulls back like that. Okay? So a nice little open position. It'll help us open up the elbows, open up the chest. It helps us activate the back muscles a little bit. And that'll be a good position just to do a minute or two in bed at night. All right, let's flip over on your stomach and go face down. All right, good. All right, so now we got Ken face down. We're going to talk about his feet a little bit after we get his low back up here worked on for a couple minutes. We are working on Ken's internal rotation of his feet and of his hips, and we're just checking how the left side feels and how the right side feels. What we can see up in the body is that his left hip's a little higher than his right hip. We can see how his kind of shirt and stuff's torsioned over to this way. So we know Ken's gonna have a little bit more right side low back tightness tension that we need to work out. When I check his hip crests, or his ASIS they're called, his pelvis is a little twisted over to this right side. So we definitely wanna work on squaring up and balancing throughout the musculoskeletal system. And to do that, we do muscle work adjustments plus postural activation exercises, squaring up the feet, different upper and lower body exercises to help him become a little more in tune with his posture. All right, so we're gonna get into, let's pick this up a little higher, buddy. Perfect, good. And then Ken feels this big nodule right through here.
Mm-hmm.
Is that tender at all, or is it just a little sensitive, or not really feeling anything?
It's not really that sensitive at all. It's just tightness.
Yeah. Sometimes when muscles are irritated, they'll become painful. Sometimes they become a little tender. Sometimes they even become ticklish. And there's kind of two levels or two modes a muscle can function in, and that's too tight or sometimes too weak. One muscle will commonly compensate. It will tighten up to create spinal stability, which ultimately turns into loss of range of motion. And so, and as well as back pain. And so with some bilateral treatment, we're helping to just elongate and stretch out and loosen up some of the fibrous adhesions. He's got some stuff over here on the upper left side, a little bit more around L1, L2, L3, and that lower thoracic spine, so called his TL junction. And so if Ken was a little closer, we'd recommend having this done probably 10 to 20 times to really balance out the skeletal musculature around the lumbar spine. And each session that we undergo, we get a little looser. We balance the muscles out a little more. But then we also have some at-home work to do. Good. And good. Okay. Bend up your right leg for me. Go ahead, push into my hand gently. And just to what's tolerable with this right knee. Good. And relax for me. And you guys, maybe that are watching this video have seen some of the other clients stop for me that have been able to get their heel to their butt a little easier and stop the whole way down. Ken's stop point and relax for me is probably right around 120 degrees, like right here, of knee flexion. Ultimately, push with daily repetitive postural exercises. Push, stop, push, and stop the whole way down. Stop, stop, stop. And push, and stop, and push, and stop. You guys see how we're kind of curling his foot, curling his toes. Push one more time, and stop whole way down. Don't push again. Good. You guys kind of see how we're curling the toes, helping to form the foot, the plantar fascial muscles. And we're stretching the lateral, the outside leg muscles, the outside ligaments and tendons down into the foot. This is his left knee, his non-surgery knee. Push. And you guys can see how he goes much easier on the left side. Push. Stop. You guys will see we're about 3-4 inches, 2 inches away. One more push. And one more stop. And one more push. And one more stop. And one more push. And one more stop right there. You guys can see how we can pretty much get his right heel to his right glute, or his left heel to left glute. And then one more time on this right side. Push. Stop. Hold it, hold it, hold it. Push. And stop. And push. And stop. And push. And stop. And we're getting a little further. One more time, push and stop. Now this creates temporary change in the lower body, but it does help us to just loosen his pelvis up, his leg muscles up a little bit, so we can hopefully get a little bit better low back adjustment. We are gonna want him to do some at-home work where he stretches and flexes the knees, especially the right side, so he can regain some range of motion down into his right knee. All right, let's go with the adjustment. Take deep inhale, exhale out. Good. Deep inhale, exhale out, whole way down. Good, deep inhale, exhale out, whole way down. One more, there we go. All right, let's face over to the right side up for me. All right, good. All right, so now we got Ken face down. We're gonna talk about his feet a little bit after we get his low back up here worked on for a couple minutes. We are working on Ken's internal rotation of his feet and of his hips, and we're just checking how the left side feels and how the right side feels. What we can see up in the body is that his left hip's a little higher than his right hip. We can see how his kind of shirt and stuff's torsioned over to this way. So we know Ken's gonna have a little bit more right side low back tightness tension that we need to work out. When I check his hip crests, or his ASIS they're called, his pelvis is a little twisted over to this right side. So we definitely want to work on squaring up and balancing throughout the musculoskeletal system. And to do that, we do muscle work adjustments plus postural activation exercises, squaring up the feet, different upper and lower body exercises to help him become a little more in tune with his posture. All right, so we're going to get into, let's pick this up a little higher, buddy. Perfect, good. And then Ken feels this big nodule right through here.
Mm-hmm.
Is that tender at all, or is it just a little sensitive, or not really feeling anything?
It's not really that sensitive at all. It's just the tightness.
Yeah. Sometimes when muscles are irritated, they'll become painful. Sometimes they become a little tender. Sometimes they even become ticklish. And there's kind of two levels or two modes a muscle can function in, and that's too tight or sometimes too weak. One muscle will commonly compensate, it will tighten up to create spinal stability, which ultimately turns into loss of range of motion, and so, and as well as back pain. And so with some bilateral treatment, we're helping to just elongate and stretch out and loosen up some of the fibrous adhesions. He's got some stuff over here on the upper left side, a little bit more around L1, L2, L3, and that lower thoracic spine, so called his TL junction. And so if Ken was a little closer, we'd recommend having this done probably 10 to 20 times to really balance out the skeletal musculature around the lumbar spine. And each session that we undergo, we get a little looser. We balance the muscles out a little more. But then we also have some at-home work to do. Good. And good. Okay. Bend up your right leg for me. Go ahead, push into my hand gently, and just to what's tolerable with this right knee. Good. And relax for me. And you guys, maybe that are watching this video, have seen some of the other clients stop for me that have been able to get their heel to their butt a little easier and stop the whole way down. Ken's stop point, and relax for me, is probably right around 120 degrees, like right here, of knee flexion. Ultimately, push. With daily repetitive postural exercises, push, stop, push, and stop the whole way down. Stop, stop, stop. And push, and stop, and push, and stop. You guys see how we're kind of curling his foot, curling his toes. Push one more time, and stop, whole way down. Don't push again. Good. You guys kind of see how we're curling the toes, helping to form the foot, the plantar fascial muscles. And we're stretching the lateral, the outside leg muscles, the outside ligaments and tendons down into the foot. This is his left knee, his non-surgery knee. Push. And you guys can see how he goes much easier on the left side. Push. Stop. You guys will see we're about, 3-4 inches, 2 inches away. One more push. And one more stop, and one more push, and one more stop, and one more push, and one more stop right there. You guys can see how we can pretty much get his right heel to his right glute, or his left heel to left glute. And then one more time on this right side. Push, stop, hold it, hold it, hold it. Push, and stop. and push and stop. And push and stop. And we're getting a little further. One more time, push and stop. Now this creates temporary change in the lower body, but it does help us to just loosen his pelvis up, his leg muscles up a little bit, so we can hopefully get a little bit better low back adjustment. We are going to want him to do some at-home work where he stretches and flexes the knees, especially the right side, so he can regain some range of motion down into his right knee. All right, let's go with the adjustment. Take deep inhale, exhale out. Good. Deep inhale, exhale out, whole way down. Good. Deep inhale, exhale out, whole way down. One more. There we go. All right, let's face over to the right side up for me. Cross here, cross here. Take deep inhale, exhale it out, whole way down. One more. Good. Other side for me. All right, one more inhale. Exhale out, whole way down for me. Relax that upper. Good. Flatten your back for me. Okay, so we got a couple vertebrae in the low back to adjust. Ken's definitely got some postural work, some mobility work to work on his legs, his ankles, his knees to develop a looser low back, more flexibility, more range of motion in his lumbar vertebrae. So we're going to talk about one exercise for the right knee as we finish up. But let's take a look at what feet look like after years of injuries, double bunionectomy he's had to the toes. He's had knee surgery on the right foot. We've got bunionettes, which are these little guys here. You can see the difference in between the left healthy foot, the right foot, which is starting to curl and develop some hammer toes or some cross toes, where the toes start to kind of spread or, cross over here. Now, Ken, we've worked on a little bit with some toe spacers. So he has started to wear some toe spacers at night that will help him to stretch and open up these toes. One exercise we want Ken to work on at home, though, is going to be what we call a double foot squeeze. And you're going to start at home to point your feet down towards me, and you're going to focus on your left foot first. And you may get some cramping in the bottom of the feet, so you let me know if that happens. I want you to focus on pointing the left foot down and then curling or squeezing the left toes down. And for 10 to 30 seconds. And then we're going to focus on the right foot down and squeezing or flexing and curling the right toes down. And all we're doing here, Ken, is just activating the plantar fascia. You guys can see how his calf starts to activate. So this is a simple back chain activation exercise that's going to gradually help him with some of the surgery, some of the scar tissue he's developed on the top of the foot. Let's go back to the left foot. And you're going to feel how the left side's a little easier than the right side, I think. You might, you might feel the muscles on the bottom of the foot working a little stronger on the left foot than the right foot. Let's hold that left foot down, but then shift our focus over to the right foot. We're going to point the right foot. We're going to squeeze the right toes. Do you feel any tension on the side of the ankle here?
Right outside of my ankle, yeah.
You feel how tight out here? Okay, so let's keep working that right there. So something Ken can do easy at home to help better his foot ankle strength is the double foot points, the double foot squeezes. And Ken's just going to shift his focus back to the left foot. And what we're going to do over here on the right is a little instrument assisted, a little fascial reduction around the right foot. And when we say fascial reduction, I just mean getting into the synovium, the connective tissue, the fascia down here. And did you cramp a little bit?
On the Achilles and that side of the.
You feel how that's kind of straining a little bit?
Yeah.
All right. So that's important that we realize that, because as we do this exercise, a lot of the weakness, the muscle weakness down the back of the leg, it's going to start to get stronger. It'll make your toes a little more flexible, and it's going to help to prevent more toe crossing, more bunion formation down into the foot. This is a great stretch for the top of the ankle. Let's just relax everything now. And the best treatment for the outside of the foot, Ken, is going to be kind of starting to stretch the foot down and in like this. Yeah. You want to think, squeeze the feet down, point the toes down. And now let's do the opposite, feet up and then toes down. So I want you to pull feet up, yep. Try to think, squeeze your left toes down. And this is where we get into our toe curls. And hold it. And now let's focus on right toes down. Let's turn the feet in a little bit. Correct. Let's focus on left foot squeeze. And then let's focus on right foot squeeze. And in your brain, I just want you to go back and forth from the left side to the right side and hold each foot or focus on each foot for about 10 seconds. Let's focus. Yeah, there you go. Do you feel the little leg muscle workout that you're getting? Yeah, burning like crazy.
On the outside, especially my right foot.
Stretching and straining a little bit. The left foot is so much easier. The right foot is the side that we need to really start to work on the curls, the muscle activation down into the foot. Super important, guys, as athletes, that we work our feet and we stretch our feet and we get our ankles to be nice and strong in that down and in position. Okay, let's do little toe adjustments if we can.
Usually I get a pop on the big toe.
Yeah. All right. Right foot. Good. Good. That's the stiff one. Big toe. Good. Okay. And now right side. All right, good work. Ankles. Relax this right ankle. Oof. All right. And now left ankle.
Oh.
Now this side pumps a little bit. It's a little sore. The right side does not pump at all. This here, there's a little bit now after we loosen the left up. Good. Okay. So feet down, toes down. At home, you're going to work on this in bed at night, or if you're watching TV, you can lay flat on your back on the floor. Start to work left foot squeeze down and in, right foot squeeze down and in, about 10 times left and right. And then we're also going to work feet up, toes down, and you're going to work on that movement right there. And then right foot. And about 10 to 30 seconds of focus on the left side, the right side. Okay?
Okay.
All right, good work. The right knee, left knee, we can get a little more. And here. You okay right here?
Yes.
Good. All right, good work. All right, up into the neck. Put hands on thighs for me. And relax right here. Turn. One more there. Turn. Relax. Good. And now over here. Good. One more time. So let's get that left rotate. All right, sit up tall for me, buddy. Spin over to the right. Yeah, one more here. All right, good work, good work. Okay, scooch forward. And palms down and in. Right here. And now sit tall. All right, so we want you to power up your back. We want you to power up your stance. We want you to work on some foot squeezes for us, which will help us to balance the body out better. All right, last thing we're going to talk about today is the Novoso, the NeuroBall it's called. And this is a great foot tool, also a hand tool, but it's got some texture on it. And what we want Ken to do, let's actually stand up, Ken. He's been using this a little bit at home. This is a great treatment tool to help the plantar fascia in the foot. And what he's going to do, let's just square your feet up. So put your left foot over here and then just hold onto the wall for balance. And what I want you to do, Ken, kind of roll the foot over the ball gently and pull it back. Apply some pressure right down through here. and backwards and forwards. And the cool thing about the neuro ball is it's got those little nodules on it, the little sensory stimulation nodules. And this is a good exercise to do in a seated or a standing position. Standing's a little more aggressive, but he's just going to gradually roll the ball, the foot over the ball, and he's going to start to feel for any tender or tense areas in the plantar fascia musculature. And he can spend about 5 minutes per foot just kind of rolling out some of the muscles, as well as, let me pick this foot up. Let's go right here. Pick it back up, put it right back down onto it. And then let's try to let the foot kind of bend over this way, over the ball. Good. And then back for me. Nope. Down and in, and then back, pull back. Okay. And I want you to push down right through here. And try to find any tender areas in the bottom of the foot.
Yeah, right there.
Right there. Yeah. Hold on that tender spot, and then just gently kind of apply a little pressure down and try to bend the toe. Yes, like that. Yeah, right into there. So guys, what we're doing here with the neuro ball is helping to create some stimulation, some circulation down into the bottom of the foot. He's going to use the neuro ball for about 5 minutes per side on each leg or each foot, right foot and left foot. This is a good self-treatment at home. It's a little better than a lacrosse ball because of the texture. This is from the company Naboso, which we like to work closely with. They produced a lot of the textured equipment that we use with our patients to help improve circulation and nerve stimulation or nerve activation down into the bottom of the foot.
Right there.
Right there. Right there. Yeah. So we really want to improve the circulation down to the toes to prevent further arthritis from developing, further joint degradation and irritation. All right. And then you'll do about 5 minutes on the right, about 5 minutes on the left. You'll arch of the foot, the lateral arch of the foot. Most of the time, though, we do want to focus on the inside ankle bone high, the medial malleolus. So he's going to kind of work to bend the foot down over the outside edge of the ball and just start to maneuver and manipulate the soft tissue structures in the bottom of the foot. Bring it back to the toes. Curl your toes down over the ball. All right, you can go laterally, sideways a little bit, good, and back to the side here, and just start to strengthen, or stimulate the bottom of the foot. We're going to pair this with his foot squeezes to really get the plantar fascia nice and strong.